Hello and welcome back to OncoTrial Insights with Dr. Pidugu, where we break down the latest in oncology clinical trials for everyone. I'm your host, Christine, and with me today is Dr. Pidugu. Today, we're diving into some exciting and promising results from a recent Phase 2 study published in the New England Journal of Medicine on Zenocutuzumab, a bispecific antibody that's showing remarkable efficacy in treating NRG1 fusion-positive cancers. Welcome, Dr. Pidugu.
Thank you for having me, Christine, and thank you to our listeners for tuning in. Before we get started, I'd like to share a brief disclaimer. The views expressed on this channel are solely my own and do not represent those of any institution, organization, or employer. This content is for educational and informational purposes only and should not be considered medical advice. Always consult a qualified healthcare professional for medical guidance. The medical information on this site is provided as information only and is not to be used or relied on for any diagnostic or treatment purpose. Please consult your healthcare provider before making any healthcare decision. The contents and other forms of communication such as text, graphics, images, and other material created by this channel are for information purposes only. The information I will discuss is not meant to endorse or criticize any specific products or brands. My goal is to provide you with educational content, shedding light on various topics. So what you're about to see is purely for educational purposes only. Now, with that said, let's dive into the topic at hand. NRG1 fusion-positive cancers are a genomically defined subset of solid tumors that, until now, lacked any approved targeted therapy. This study reveals how Zenocutuzumab could potentially fill that unmet need.
So, let's break it down for our listeners. What NRG1 fusions are, how Zenocutuzumab works, and what this trial means for cancer care.
Exactly. To kick things off, let's talk about NRG1 fusions. These are rare but recurrent genetic alterations found in multiple solid tumors, including non-small cell lung cancer and pancreatic cancer. When NRG1 fusions occur, they produce abnormal proteins that bind to HER3, triggering its dimerization with HER2. This interaction activates downstream signaling pathways, promoting tumor growth and survival. These fusions drive cancer progression by hyperactivating the PI3, KAKT, and mTOR pathway, which promotes cell proliferation and survival. Unfortunately, standard therapies have shown limited efficacy in this genetically defined group. That's why there's a need for precision medicine targeting these specific oncogenic drivers. Now let's discuss the star of the show, Zenocutuzumab. It's a first-in-class bispecific antibody designed to target both HER2 and HER3 simultaneously. This dual mechanism of action blocks the HER2 and HER3 dimerization and prevents the NRG1 fusion proteins from binding to HER3, effectively suppressing the tumor's ability to grow and spread. What makes Zenocutuzumab unique is its ability to independently disrupt the HER2 and HER3 signaling axis, which is a key driver of tumor growth in NRG1 fusion-positive cancers. This mechanism makes it a promising candidate for treating cancers that have far been resistant to conventional therapies.
Let's get into the clinical trial details.
Sure, the Phase 2 study we are discussing demonstrated impressive clinical activity with Zenocutuzumab in patients with the various NRG1 fusion-positive cancers. The study shows a significant tumor shrinkage and durable responses, offering hope for patients who previously had limited treatment options.
What were some of the key findings from the clinical trial that our listeners should know?
Well, this was an open-label study, meaning both the doctors and the patients knew who was receiving the drug. The study enrolled 204 patients with 12 different tumor types, including non-small cell lung cancer, NSCLC, pancreatic cancer, breast, gastric, and ovarian cancers. Among the patients with measurable disease, the overall response rate was 30%, This means that nearly a third of the patients experience significant tumor shrinkage. Specifically, in non-small cell lung cancer, the response rate was 29%, with a median duration of response is 12.7 months. And in pancreatic cancer, it was an even more impressive 42%, which is remarkable for such a tough-to-treat cancer with a median duration of response of 7.4 months.
That's remarkable. What about how long the treatment worked?
That's pretty significant, especially for pancreatic cancer, where treatment options are extremely limited. The median progression-free survival across all patients was 6.8 months, which is encouraging for a heavily pretreated population. This indicates that the treatment not only shrank tumors, but also helped to control the disease for a significant period. Another key takeaway is that the efficacy was consistent across different NRG1 fusion partners, highlighting the broad applicability of Zenocutuzumab in these genomically defined tumors.
Let's switch gears and talk about the safety profile. What about the side effects? Is this treatment well tolerated?
For the most part, yes. The adverse events were primarily grade 1 or 2, meaning they were generally mild to moderate. The most common side effects considered related to Zenocutuzumab were diarrhea, fatigue, and nausea. Infusion-related reactions occurred in some patients but were manageable.
That's reassuring. It sounds like Zenocutuzumab offers a significant benefit with manageable side effects.
Exactly. This trial marks a significant step forward in precision oncology. By identifying and targeting specific genetic drivers like NRG1 fusions, we can provide more effective and personalized treatments. Zenocutuzumab represents a potential new standard of care for these patients, offering them hope for improved outcomes.
So, what does this mean for patients and clinical practice? The eNRGy study demonstrates that Zenocutuzumab offers durable anti-tumor activity in NRG1 fusion-positive cancers, particularly in NSCLC and pancreatic cancer, two cancers with historically poor outcomes.
Absolutely. The results make a strong case for regulatory submissions to approve Zenocutuzumab for NRG1 fusion-positive cancers. Additionally, it highlights the importance of RNA-based next-generation sequencing for accurately detecting NRG1 fusions, as DNA-based methods may miss these alterations. And moving forward, it will be interesting to see if Zenocutuzumab could be used in earlier lines of therapy or in combination with other treatments. The basket trial design, which demonstrated efficacy across multiple tumor types, also supports broad applications in precision oncology.
To wrap up, this is truly groundbreaking.
Exactly, the eNRGy trial has revealed Zenocutuzumab as a potential game changer for NRG1 fusion-positive cancers. With a 30% objective response rate, durable responses, and a favorable safety profile, it offers new hope for patients with these rare and hard-to-treat tumors. And moving forward, it will be interesting to see if Zenocutuzumab could be used in earlier lines of therapy or in combination with other treatments.
Dr. Pidugu, thank you for sharing your expertise and breaking down this important clinical trial for us.
It's my pleasure, Christine. It's crucial to keep our listeners informed about the latest advancements in cancer research and treatment.
That's all for today's episode of OncoTrial Insights with Dr. Pidugu. Don't forget to subscribe, leave a comment, and share this episode with your colleagues. Until next time, stay informed and keep advocating for better cancer care. Be sure to tune in next time for more updates on cutting-edge clinical trials.